All right. Again, welcome to the MAMES Nebraska State Networking Session. And this session is for providers just to talk about the recent updates of what's happening in COVID and have an opportunity to network amongst each other and ask questions and whatnot. So with that, the goal of this session is not for me to talk. It's just an opportunity for you guys to kind of talk back and forth and ask questions of one another. So I will throw it to the floor if anybody wants to start the discussions out. How about this? One of the big questions and big discussions in pretty much every state session is talking about what people are doing related to the Medicare rules, where it's okay to not have a signature on the delivery slip as long as you indicate it's a COVID-19 patient, whatnot. But there's a huge issue with folks on how they're getting the assignment of benefits for Medicare. And so is anybody having any successes or having any issues with that?
So with our first-time customers, we will have them sign the paperwork if they come in. So we do get that hard signature on brand new customers for both the ticket and the assignment of benefits. But then if they're recurring customers, we just write, COVID and that we took it out to their car or they came in the office and picked it up. Since we do have that assignment of benefits order or signed on a previous copy of the ticket, since most of what we do is, recurring supplies. As long as we have it in the past, we've just kind of been doing it that way.
Okay. Todd, do you know what you guys are doing?
It's somewhat similar. I'll give a shout out to Jackson for this. We've moved a lot to drop shipping. So our proof of deliveries from the delivery service that's like 90% of our business right now. And then the stuff we do deliver, if there is a situation where we can't get a signature, they have done the COVID-19, but I'm very skeptical how that's going to hold up. They say it's going to hold up now, but when they do audits. But most all of our customer interaction is via UPS or FedEx now, and we're using proof of deliveries, okay, which has been very effective.
Yeah, we do that on most of our orders too, because like Todd said, we drop ship most of our stuff with Jackson, and so we've got that proof of delivery that way.
Yeah, I would say at Frontier, I can speak probably more on behalf of a lot of our remote CPAP setups, as we're doing something very similar. We do drop ship, but then we also, all of our paperwork that we need to get signed, we're using HelloSign. And that seems to work pretty well, just to make sure that we get as many of the documents that we need signed as possible. So.
Oh, cool. HelloSign. So is that where you can like load in the document and then send it electronically via email?
Yes.
Or okay.
Yep. Yep.
Cool. Is that an application? I've not heard of that.
I don't honestly really know. I don't know if it's in an app form. I believe it is. Because I've gotten documents even on my phone that I've been able to sign right then and there. So it probably is. I'm sure it could work both on PC and on a tablet or smartphone.
Cool.
So.
Was it like DocuSign, Jody?
Yeah, it's like DocuSign. Yep.
Okay.
Is that what you use, Franny?
We don't use it. No, I just know that we've, during COVID, a lot of things we have to sign on a personal level have been coming through that way.
Oh, okay. Okay. Yeah, because I think,
I was curious if that was similar.
Yeah, I think what everybody's worried about is, a lot of folks didn't know when CMS released, when they did waive the signature for delivery. I think a lot of people just assumed assignment of benefits was included on that, because almost everybody I'm talking to, they have their assignment of benefits right on the delivery form. Well, obviously, if it's okay to not have your delivery form signed as long as you indicate COVID. there's a lot of folks that are pretty worried for that window of time when they didn't know you were supposed to get a wet signature. But we've been working through the DME MAC councils in all 4 regions and the medical director explaining what the issue is, really pushing back, and the DME MAC folks do understand that problem, and they've been trying to get an answer from CMS regarding it. And we just followed up because we have another member in South Dakota that, they're extremely worried because they didn't do that. And you can't go back and, get those on those few patients. And so they said they were still working with CMS, but I don't anticipate CMS will change it at this point. So, any other discussion on that? How about anybody have any questions or want to bring up a discussion?
We had a conversation about vaccinations here, and I know we are not a typical DME based on the industry. I'm curious to hear what people's opinions are on that, because we feel here we probably don't need the vaccination. We should let it go to somebody else because we just don't have that frontline interaction. While Franny, I would say you guys are probably frontline with people. I guess I'm curious to hear what people are thinking there, because I know AA Home Care is pushing for us to be in that mix. And Rose, you sent out some information yesterday as well to contact the governor and get contacts for the governor. So what are people thinking there?
I know that we, because of our frontline individuals, we have a lot of staff that I think have kind of expressed they feel it's important. But then we kind of have a mix of those that wouldn't get the vaccination anyway. And so that's tough. I think having it there, similar to the flu, where maybe they come in and provide, but then it's up to each individual, to make their own decision, obviously. But we haven't really made any kind of group leadership type determination on how anything would be handled.
I was actually just thinking about that very thing yesterday. I think for Frontier, because we are similar to Franny, your stuff as well with NIV and oxygen, still delivering that stuff to patients. Those employees are definitely more frontline than somebody doing billing back at the office. Now, one of the things that I was thinking yesterday, like, what do we have as far as how far can we go when it comes to mandating that certain employees, if there is a way to do that, or if that's even legal, I don't really know. But obviously we want to protect not only patients that are coming to the branch, but we want to protect our fellow employees as well. So yeah, I don't really know how we're going to do that, but I would say that people are frontline because we are delivering at long-term care and all those different facilities. So
yeah, I can tell you, we had this discussion, I think it was in, I can't remember which one now. Anyways, the hospital system was getting their stuff ready to receive the vaccine. So they had ordered a giant fridge type thing. And I believe they had a requirement in the system that that was your condition of employment. But again, there's even several nurses that are like, I don't, how can you force me to take that vaccine when I don't believe, whatever their beliefs are. But I think it was in their respective policy long before COVID. But yeah, that was a big topic of discussion in a couple of our meetings. How can you force it? You can't without some type of, history of this is your policy, it's your condition of, employment. And I know, like, I worked for a hospital system for several years, for 13 years, and they always offered but didn't make us do the flu shot. So we could go get our flu shot at work and it was great, you didn't have to worry about it. But there were people that were totally opposed to that. So it wasn't an issue then. But
Well, and I think we're still hearing that the efficacy rate may be 95%, but it only is going to last for what, not 3 to 5 months? Is that right?
I think it was 3 months last I heard.
So now we have to start over again. You know, it's going to be interesting how it all plays out over the next year. Wow, I really don't care. I just want to get 2020 gone. So.
Well, I heard last night watching the news, and again, of course, everything's true on the news, that, you know, of course, the health frontline workers, healthcare workers, and then it would be next then long-term care, and then next would be like first responders. And then the general public, you're looking at 6 months out. So it would be, you know, midsummer to fall for, you know, non-essential people, if you will. So Jim was like, okay, I guess we're not going to get it for a long time, because he would be the first one standing in line if he could get it. But one of the things that I think we should try is, it still wouldn't hurt, like in the local communities, to try to, you know, advocate for your frontline staff, you know, again, because obviously it's up to the state first, and then the state distributes to each, I don't know if it's by county or city, but they were just talking last night in our local area, you know, how it's going to be done. So they might have some flexibility. So I think that's another option too, is, you know, especially for those frontline, like Jody and Franny, you know, the folks that do the setups for the equipment or the rehab. That might be.
Todd, what is your company? Or Rose, what is Todd's company?
Todd, are you on the line?
Oh, I didn't hear the question. Kubot, yeah, Kubot Healthcare
You guys
in Omaha.
What do you think?
About the vaccinations, I think it would be if in the past we do a lot of flu vaccinations, and for our employees, we give them the opportunity to get it if they would choose to have that. So for this, it would probably be the exact same thing. Most everybody here has had the COVID, so I don't know if they're immune to it now, or if the science even on that has even been figured out, but we would give them the choice. We wouldn't be forcing anybody to do anything like that.
So
unless they wanted to.
What about frontline workers? Because I know, Rose, you asked for contacts at the governor's office. Is the general consensus for all the companies on this call today is that we should try to get it for the workers? And if so, I support that. I just want to know what you want, because we're probably the odd man out here, and we'd say.
I say yes. Jody.
Jody says yes. Franny, you're nodding your head yes. Todd, what are you nodding? I can't see you.
I would say yes too. I'd back that.
So I'm okay. I'll scrounge up some names and numbers for you, Rose, and we'll send that stuff over to the governor's office, because if that's what the consensus is, we can support that.
Awesome. And what we can do is even, you know, to not, I think just to explain to them, so we might expand a little bit on that letter, but just to, you know, really explain the situation, especially like I said, when we're doing respiratory setups on a respiratory disease, you know, that's just crazy why they wouldn't be considered frontline.
Yeah, and it's, you know, even for NIV, it's not even just the setups, but it's all the follow-up stuff that we're required to do. And some of it can be done remote because of the modems, but a lot of that stuff really does need to be face-to-face. We try to do as much face-to-face stuff as we possibly can, even throughout these times, if it's possible. But yeah, looking at those disease states, neuromuscular, COPD, heart, diabetes, I mean, the list goes on and on. I would say that it'd be foolish for us not to want to try to get that taken care of. And I agree. I don't think the jury is out when it comes to the antibodies being built in the system for a certain period of time. I really don't think we know the answer to that. And even if the vaccine, you know, keeps us healthy for 3 months, I'm sure, you know, it's still worth it in the short term, but kind of frustrating at the same time. So.
Yeah, we're hearing more and more. In fact, we had a provider owner executive management committee meeting last week, and one of our co-chairs, he was talking during the meeting saying, he asked everybody, what's your thoughts about taking the vaccine? Are you guys going to do it? So it turned into about a 20-minute discussion back and forth. And because he was waffling, he's like, I will have my kids do the flu shot and, that, but I'm leery about this one. Right. So we got all done with the conversation, and there was one individual that was talking. He's from the pharmacy world, came into DME and explained, goes, I've been doing a lot of research on this. And he said, I would be the first in line. Your choices are, some of the side effects from the vaccine versus getting COVID. And I would take the, side effects of the vaccine before that. And so that individual that was on the fence was like, oh, okay, well, that really makes sense. Found out Monday morning, that individual ended up with COVID and has it really bad. Had to have fluids, IV on Sunday. And it's just like, I said, I would love to talk to him now, and just, there would be a no ifs, ands, or buts about it. He would be first in line. Okay. Any other discussion on that? So we do have a takeaway from there. We'll go ahead and thank you, Joe, for any help, or anybody else. If you have, we'll send it to everybody. So any contacts you guys send me, we'll go ahead and get her sent in. Big discussion. And again, Joe, apologize. And luckily we have Craig on the line. I told you the glove discussion yesterday came up in Minnesota's meeting, and Craig on the line sent some information. He's been working on this issue quite diligently. So Joe, do you want to just give an overview for Craig of what you've done so far in reaching out to the state, and what the state responded to and what they're looking for?
Basically, I just reached out to the program specialists for DME here in Nebraska and talked to them. And I think this came up in one of our insurance calls about 2 or 3 months ago. And so I put a bug in his ear saying, hey, could potentially be an issue. And now we're really seeing it as an issue because the margins are dissipating when it comes to gloves. And so I'd talked to him 2 or 3 different times, and then last week he'd reached out and wanted to know what other states were doing. So I'd reached out to Rose, hoping that maybe we could get some other state information where they're increasing those allowables, because right now we're being pinched in the middle. McKesson, and I know Jackson, I know you're on the phone here. I know McKesson can't do anything about it because it's something that's being handed to them. Those price increases continue to happen, but we need to figure something out, because as those margins dwindle, we might see things disappear for all of that. So hopefully Craig has some really great news from BGM.
I do have, yeah, this is something we've already worked on in several other states, and have seen movement from other state Medicaid programs in terms of changing their allowables, whether temporarily or permanently, because of Washington is probably the most recent example. And when we first engaged them and reached out to them, they were just like, well, you're the only ones that are saying anything about this. It's not a problem. It's just, you're one company, or the state association coming on behalf of a couple of companies, whatever. It's just not a problem. We're not hearing this anywhere else. And yeah, we were able to show them several articles, both from within the industry and some even outside of our industry, highlighting the issues, highlighting the immense cost changes that are occurring. So we've now seen state of California quadrupled their reimbursement on gloves. Connecticut has changed theirs, and I ended up, so yeah, there's 6 or 7 states that have already changed it. Some others may be considering it. I don't know that every state in the country has been reached out to and had this discussion. You know, I pulled all 50 state fee schedule, Medicaid fee schedule allowables. You know, I don't know, 38 or 40 of them have allowables. There were 10 or 12 that did not have an actual dollars and cents reimbursement rate on their fee schedule for the A4927 code. But there's quite a variance. They start down at about just under $4 a box in some states. And I think West Virginia was at like $42 a box. So yeah,
Wow.
you can start selling those in West Virginia, maybe. But a lot of them were in the $7 to $9 range. And I don't remember offhand where Nebraska falls with their fee schedule, but yeah, like California was at 4.5 cents a glove. They quadrupled that to 18 cents. So $18 a box is where California has moved to. A lot of them happened. I know one of them was October 1st. I'm just saying a lot of words now at this point. So I'll stop and see what your thoughts are on all of this. And if you think, Rose, I sent Rose that information. She can share it with you as well. If you think any of that will be helpful. Some of the articles, again, from within our industry and some outside of our industry that really highlight the problem here. There's a 60 Minutes clip Sunday night, I think, that highlighted a lot of the PPE. You know, you say it's price fixing, gouging, whatever. It's not McKesson that's doing it. It's not you guys that are doing it. This is what it's costing you now. So if you want, you've always gotten gloves from us. If you want to get gloves from us, this is what it costs. Yeah. Is it right? I don't know, but it's reality. It's what we're all faced with. So
I'm concerned with the solution though, because it's going to continue to move up, and I don't know how we peg it. You know, just quadruple it. It's like, well, that's still going to put us in a bind in a couple months.
And that was their question. Okay, well, what does it need to go to? We're like, well, we don't really know. Right now, today, it's not covering the cost. Here's what would cover the cost. Just know that a month from now, that might not be good enough either. And we may have to revisit this again. And I need your commitment that you're open and willing to do that. You can't just say, well, we'll move it to this, but that's it. We're done after that. This is a very fluid situation. So, you know, Tennessee has a cost plus as their methodology for reimbursing for gloves. It's cost plus 15%. Then you can argue, well, is the 15% margin sufficient on it? Yeah, your costs are always going to be covered. That's a solution, but you just have to then agree on what the right percentage is above cost. And you have to send in your invoice then and show them that here's what I paid for it. Okay, paid $100, so you pay me 115, and we call it good.
Yeah, and that also increases the administrative costs both on our end and on the
Correct.
MCO end as well.
Joe, what's the reimbursement for gloves for Nebraska Medicaid?
I think it's $11.20 per box.
Oh, it is.
Mhm.
Okay, because Minnesota's was 9 something, and we thought that was pretty high. Okay.
Yeah, at 1120, you're one of the better reimbursed states. And like I said, Rose has the spreadsheet with all of the states if you want to see how you compare to other states. But at the end of the day, that doesn't really matter, just because they're doing, just the message is that yes, this is a problem and other states are addressing it. If Nebraska needs to do that, then the article I wrote and the articles I pinned within my article should help tell that story, rather than just being you sitting in front of them saying, hey, I'm a supplier of this stuff and I need paid more. They hear that all the time, and they don't always believe that, unfortunately. So at least that gives some outside perspective as to what this problem really looks like, and that it is real.
The other concern that I have, and I know we discussed this 3 months ago, was increasing the volume, or with COVID, we should be very careful about what we're doing and make sure we glove up. But I don't think we have the quantity out there. And Jackson, maybe you could talk to this. I know Chris has said somewhat of the same is we may not have access to more than 3 boxes per month, and that's going to be an issue.
Hey, Joe, sorry, I think I was on mute there. Hey, this is Jackson. Yeah, to speak to the allocation part, I know we're definitely seeing the demand for the gloves just isn't going anywhere, particularly on the nitrile versus the vinyl. We've seen vinyl supply start to at least come back into our warehouses a little bit more. So we are a little bit more confident on vinyl supply here going in the next few months. But yeah, to be honest, nitriles, we've seen just an incredible amount. I know we've talked about this plenty of times, but just the actual sheer demand for the gloves, I don't think is going anywhere right now. I know there was some news in the news about, Top Glove, a big, manufacturer supplier in Malaysia that, had a big case of COVID outbreaks and was going to impact the market. McKesson does not actually procure any product from Top Glove. So we are not impacted by that at all. So at least, from what you're hearing in the news in regards to that, McKesson isn't, impacted at all there, but we are still seeing, generally in the marketplace that just the demand for these gloves is not going anywhere. And we are continuing to at least, keep out our e-commerce and, our resellers in the market from taking any of that supply and kind of diverting it to the HME and long-term care market. But yeah, as you know, the allocations is definitely a pain in the butt. But we, at least as reps on the HME side with McKesson, definitely understand that, it does at the end of the day kind of become a group effort. And, if it is kind of moving around allocation from one rep to the other rep in order to get the patient served at the end of the day, I think that is, for the most part, McKesson's mindset. I don't know if I speak for the entire sales force, but I know I speak at least for our Midwest team that represents and, hosts some of these MAMES calls. So we're definitely here in the fight with you, but for the foreseeable future, I do see at least a little bit of a pinch here on the, inventory, if you will, for gloves. So we will continue to see them come in, vinyl more than nitrile, but for what it's worth.
Okay, how are you guys handling, are you guys having any inventory shortages like on PPE or beds or anything like that?
That's a good question, Rose. Gloves is a great example of cost increase, but it's not the only place where costs have increased. We've seen manufacturers levy surcharges on hospital beds and
buy some more. I thought about two
concentrators in some instances, probably ventilators in some instances. So, yeah, I mean, those are all very valid. I'm curious to hear what the suppliers are seeing and doing in that regard.
And Rose, I guess, was that directed to me? I apologize.
To anybody. Yeah, I mean, I think the biggest thing, again, hearing just in other states, there is still, outside of gloves, there is still some shortages for HMEs to get other PPE in. We're still hearing about concentrator shortages, bed shortages, but not as bad as concentrators.
Sure. I will say, for what it's worth, on the McKesson end, we're opening up allocation to PPE for all customers. We are doing some spot buys with some additional manufacturers and vendors to at least keep that supply coming in and opening it up for all of our customers to be available to purchase. So we do have inventory available. So I wouldn't hesitate to reach out, but especially gowns and concentrators, we have a ton of them.
I think the only thing at Frontier right now that I'm seeing there be a significant back order on and resupply is filters. But outside of that, I haven't heard that we're having any issues with glove inventory or incontinence products. So
Interesting.
This is a little different, but I know that beds we're seeing more delays, I guess, not necessarily shortage, but yeah, definitely a delay in getting them. It's not that we can't yet, but it is taking a lot longer for us to get those.
Yeah, that's interesting. And I think there's been a lot of discussion of, you know, especially if you're ordering more, okay, what happens after the public health emergency? What are you going to do with all this overage of stuff? So that's, you know, something to consider. And I know that some of the folks have talked, you know, they have reached out to their peers. So like in concentrator shortages, not necessarily buying them, but then reaching out to other areas or other companies and say, hey, you know, can you borrow me 10, that kind of thing. So there's been a lot of that going on, a lot of networking and stuff like that. One of the other things is we've been hearing is when, you know, folks are doing their inventory or their inventory management folks, they're being aggressive and, you know, they've got their quantities on hand and what they need to have. They'll be ordering like 2 to anywhere from 2 to 12 weeks to get the stuff. And there was one statement from one of our members in Kansas who does, they are like some of you folks, Joe and Lindsay, they do nothing but supplies. And so they're stockpiling their supplies because a lot of their supplies come from China, and because of the Chinese New Year, you know, they do basically shut everything down for the month. And so if you order late January or February, you're not going to see it till March or April. So they wanted to make sure that if folks didn't know that, if you order a lot of products that come from China, to be a heads up on that. All right, any other discussion on that? All right, other big question for folks is how are you guys getting in to visit with your referral partners in hospitals and long-term care facilities?
Lots of meetings over Zoom or whatever we can get taken care of. So
That's pretty much the same for us as well. I don't know that any of our facilities have allowed us to come in outside of, you know, for specific clients, but doing a lot of Zoom and virtual type of meetings and even emails and such.
I think one of the important things to think about, and we obviously with all of this stuff going on and it going on for quite some time, figuring out how to still be productive sales professionals without necessarily having to be physically in front of those providers. But I think probably one of the positive things that has come out of COVID is that it has forced people to think outside the box a little bit on how this process should work. And I foresee that not just now, but even in the future. Quite honestly, being in charge of the sales team at Frontier, I'm always trying to think of ways from a marketing perspective on how to provide ancillary support to those sales staff that are out in the field. Because it is, you know, it's just such an inefficient system where you're physically having to drive around in your car and make stops and hope you get to speak to the people that you want to speak to. You know, I think we've had a lot of conversations, and I'm probably more transparent than what I should be, but I'm just going to say it anyway. You know, figuring out how to use your internal patient base. One of the things that we are attempting to do is really pull from our internal lists. So for instance, you know, if you're pulling a report on diagnosis codes and you see that under certain item groups, you have a predominantly high category of people that have neuromuscular disease. Okay, well, what else from a neuromuscular perspective can we offer? I think for Frontier, us being, you know, full service, having anything from bathroom safety products to all the way from that to NIV, it's really trying to provide a holistic approach to care. And I think that's the way we have to think about our industry going forward. But I think the main thing is having the capability to pull that stuff out of your system so you aren't always reliant on new business, because obviously we all know new business is much harder to get than it is to continue to keep the patient base that you already have. Even things like, I know, and this is my soapbox and I'll say it anyway, but you know, I don't think DME's necessarily done a really great job at having a strong marketing department as a whole. I think we've been good at hiring salespeople to go out and make those calls, physical calls. But what I think we're behind the 8 ball on a little bit is just, how do we utilize social media to connect with those consumers? How do we utilize email marketing campaigns to make sure that we are providing additional education and content that's relevant to each patient base, and trying to figure out how to segment those patients into certain categories and do very targeted messaging to them. That, I think, really do think that that is also probably where we need to try to get closer to in the future. It's just a matter if people see the value in having, you know, a diverse skill set in marketing. So sorry, I know I went into my little soapbox, but yeah.
Yeah, no, that's fantastic, Jody. And I think that's going to be something in the new future that, you know, everybody needs to be talking about. I know we had Ty Bello present during our fall conference, virtual conference, and he had some great resources in there. Just even, you know, for the sales rep is, you know, you no longer can get in the clinics, but you should still have that level of volume of sales, and here's, you know, some opportunities. And so he spent a lot of time, you know, talking about, you know, right now as things are ramped up, but, you know, well into the future, because you're spot on. It's changed so much. And I think it is going to open the door up for more activity, because you're not spending an hour driving to a referral source, you know, to and from, and, you know, maybe you got in, but, you know, you got there and they went out to lunch, whatever, you know. It's always been a challenge for us.
Yes. You know, and I don't know how much Ty Bello spoke on just the data analytics behind, you know, there's a bunch of different programs that you can use. So obviously Google Analytics is a big one. It's amazing how much we really are monitored. Obviously Google makes its money off of advertisement space and the data that people can then utilize just in tying their social media accounts and their websites back to Google Analytics. There's places like HubSpot, Hootsuite. Those are all like tools that you can use to integrate. Say you're on Instagram, you're on Facebook, you're on LinkedIn for more like professional connections and networking, and all of that stuff can feed into one overall platform. And then you can take that data and go, okay, well, let's look at Facebook. Facebook also has their own backend analytics. We can go, okay, well, we did 2 posts every single week, and maybe one post we had video content, and the next one we had educational material, and then the next one we had an advertisement. Which ones gained the most traction, and who were those people? Were they certain demographic, or where did they live? All those other characteristics. Did they find the Facebook ad on a tablet, or did they find it on a smartphone, or did they find it on their PC? And then thinking outside the box, you know, with people having integrated Alexas and Googles, is there advertising space on there that we can utilize to sell our organizations to specific consumers? It gets, you know, I think the data can be overwhelming, so you kind of have to start somewhere. But yeah, I think Ty is spot on with that stuff. And I just don't think we have a lot of probably knowledge on what really can be done. So.
Well, that's a great opportunity to look at targeted education moving forward.
Yeah.
Great discussion. How about other folks? All right, hearing none. How about another big thing? I think it's been tough on everybody. I think everybody has COVID burnout. How are you guys having yours? I mean, how are you handling the staffing challenges? You know, I've heard people saying, oh yeah, you know, some employees are really taking advantage of, you know, if they have a sniffle, well, you know, if you're not feeling well, I got to stay at home. So they're consistently, you know, calling in sick. And when, you know, it's just such a different time. So there's people abusing it and people that really aren't. You know, the whole testing thing, you know, when are they paying for tests? You know, do you have to pay for their time off? I mean, all these things. And because now you also have, you know, family members that, you know, there was some discussion of if a family member has COVID, you know, some of the policies from HMEs is you have to stay home and quarantine, that kind of thing. But others are like, you know, as long as they, you know, meet the requirement, they're not running a temperature, blah, 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 and everybody's wearing their mask and everybody's social distancing, you know, they can come in. So I'd love to hear about how you guys are handling some of the staffing challenges.
I think we've been pretty lucky out actual cases. We really haven't had staff that's taking advantage of and such. I think it's more of drawing that line of when we're erring on the side of caution, but then puts us into a situation where we have too many people out, and finding that happy medium of when to, you know, is it just your seasonal cold and allergy symptoms, or are we looking at something bigger, and are we going to regret not having you quarantine? Those kinds of things we've, you know, again, a fluid situation, it changes weekly on how we're handling that, and each situation is different. We have run into, I mean, I think we had 2 service technicians out at the same time, overlapping by just a couple days. So really it was, you know, almost 2 weeks of being really short staffed for our service, and pulling from other departments and other individuals to help. So that was really rough. I think somebody else said pretty much everybody's had it now. I kind of almost feel that way for, you know, for one location, but it's been tough more on that side of the service and repair. You know, when the ATPs are out, we have enough ATPs to either cover, or it's not as urgent of a case, you know, to get that eval done, or it can be done virtually while they're home. But those repairs are hands-on. That's where we really struggle, is when we have more than one that's out for that extended period of time. So I'm kind of hoping that we're past that now for a little while, now that the service tight's already hit them.
I think for us, it's been pretty, it's been an eye-opener, but it's been a positive eye-opener. Like, we've changed our phone systems. We've done some, you know, we've really introduced remote working, which has been great. We've kept the office open the whole time, but we've been able to transition in and out of remote work really easily. I do think, you know, one of the biggest concerns that I have, even though, like, I don't think we've all even had COVID yet, where we haven't confirmed it. My concern is the weakest link. Like, and we realized this a couple of weeks ago, and both my wife and I kind of ran into one of our kids being exposed. You know, like, that becomes the weakest link. Like, you can be very diligent about what you do, but then all of a sudden something out of nowhere that you have no control over, when your son sits next to some kid at the lunch table, you know, puts you all in quarantine or isolation. So I think that was an eye opener for us, and it's like, okay, how do we manage that and not trip up and not be at work the next day? So, and we're a small office, so it's hard for us to miss people. So
I would agree with that, especially the kiddos. I know this week is my first week, normal week, back to normal schedule due to kiddo, you know, being exposed. So I didn't have to quarantine, but then, you know, there's got to stay home with the kid. So that is where it was an eye opener, both, you know, at home, agree with what you're saying, Joe, but then also thinking about how many of our employees do have those young kids at home, and that causing an issue to where maybe they're not having to be quarantined, but now a kiddo does. And, you know, and there maybe, we've also had one situation where, you know, one kiddo they had to stay home with, but then it was a month or two later that the next was exposed. So it's multiple days off to the split between them and someone else.
And the 5-7 CDC guideline change last week has helped. You know, it's like, okay, now we can get in and out a little bit quicker. The one thing that we really haven't talked about, and I don't think it's kind of being discussed nationally, but I think it really needs to be focused on, is the emotional health of all of this. And I'm really concerned that yes, we may be seeing people die, but I think Governor Ricketts said last week that in the under 20 department, those rates of suicide have gone up 10 times. So 10 times the typical amount during COVID. And it's like, okay, how are we addressing that? What are we doing to help that for employees, for everybody across the board? So,
Hey, Joe, I love the fact that you're actually thinking about the mental health aspect of all of this, because I think, again, that's one thing that we don't necessarily give a lot of attention to. I have, I have a son that's in 5th grade and then a daughter that's a freshman in high school. My daughter's been quarantined twice, and each quarantine is 14 days long, and she didn't test positive either times. It was just from a random exposure. My son, once this is all kind of said and done and kids can start going to school without wearing masks, I think he's going to be anxious about it. Like, I've been wearing a mask for so long that it almost feels like I'm missing something if I'm not wearing it. Yeah, I think the stress that it's putting on parents and employees, just
end users.
Yep, exactly.
And I know we've experienced it with one individual, specifically has been having a really tough time. We've worked with, our insurance providers and different employee benefits that we have available that, we've allowed for like a counseling session, on the clock for, and encouraging them to reach out to those resources that we have as part of our employee benefit package to really utilize those and to not be, ashamed or worried about asking for that time to do so. So I know we've had a few individuals really taken, good advantage of that and utilize that resource too.
That's a good idea, Brandy.
Really good idea. One of the things, and I think Jody, you hit the nail on the head. At first, the whole mask thing, everybody was like, oh, this is so weird. This is so uncomfortable, blah, blah, blah. Well, then now you just get so used to it. Like, I walk down the street and I'm looking at everybody like they're a giant germ, and it's like, I see pictures of crowds and I'm like, oh, freaking out, So especially the young folks, I mean, it's devastating, I think. And, I hate the term the new world, but it will be interesting once we come out of this.
A girl in the office yesterday, I had to laugh. She says, anymore if somebody comes in and they're not wearing their mask appropriately and their nose is sticking out, she's like, I feel like they're exposing themselves to me. I'm just like immediately, like taken aback. And I just had to laugh because it's so true. It's like, you look at them like, put that away. Cover yourself. Cover yourself.
Funny. Well, what are you all doing? Again, it sounds like Joe and folks, you've got staff going remote. What are you guys doing to, I guess, for those that are having to be frontline, that are having to go to the office? Are you doing anything different to increase their morale? Because, again, let's face it, for those of us that are able to work at home, you miss the social interaction and whatnot, but it's not a bad place to be. But for those like, I can't stay home, I'm a repair tech, I have to go in. Are you guys doing anything special to increase your employee morale?
We are. I know for those in the office, we're maybe taking in breakfast, some mornings, or just making sure that those of us that are there in the office are doing more rounds around to be able to physically see each person, chat with them a little bit. Those at home, we're sending little care packages to occasionally because they're kind of isolated. We always encourage on any of our meetings, hey, turn on your video. I don't care what you look like today, turn on your video. We want that sense of all being together to continue, but we are doing, little things like that. And I know that we were already doing different little instances, like just random little drawings or things like that as we try for certain goals to be met. We're trying to implement a few more of those, just even a small little $5, $10 gift card type of thing, contest, those types of things to just engage them and, again, keep the morale up.
Cool. How about some others? Any other fun tips?
I think I feel like we see ourselves all congregating in the lobby a little bit more. You know, that we have a funny moral dilemma kind of situation that we come out with every once in a while, and it's like everybody flocks to talk about the moral dilemma because it's just fun, crazy stuff that we talk about. But I find that we are it's socially distanced, but having conversations a little bit more, which is good. But we still have one employee that's at works remote, so he's not always involved in it. So I like your Zoom gift card kind of idea, Franny. That would be, kind of a way to interact and make sure everybody's involved. So,
Todd, anything you guys are doing fun?
We're really not. Oh, did you say Todd?
Yeah, I did.
Not very fun. We need to be more
This
fun.
is the most fun I've had. Yeah, we haven't been doing anything. It's kind of a crapshoot who shows up, and now that everybody's really had it here, we should do something. I feel bad. Now I feel bad. We should bring in breakfast or something.
No, kidding.
Yeah.
We've done a
I
happy
haven't missed one. Yeah, I haven't missed one day. I want my breakfast.
We've done like a happy hour too, where from 4 to 5 for those at home.
Ooh.
Where it's just to socialize, and it's generally it's them venting about different work situations, or so it really does kind of end up being a little more work related. But we also encourage them to 15 minutes a day call somebody else and chat about nothing related to work. Just try to encourage that. But then we started doing the maybe 4 to 5 happy hour. Everybody gets their drink of choice and just spends time talking about any maybe struggles they have, because it really does end up being more of a networking session for them. And it's been helpful for them to feel like they're still sitting next to that person in the office and able to vent a little bit to them and do what they do as if they were in the office.
Do you kind of do it by department or just anybody
Yeah.
who wants to? Okay.
Yeah, primarily we were doing it for those that are at home, which is pretty much all of our customer care coordinators, intake and order processing. And that's generally the ones that are the ones needing it.
Yeah.
The others are spending more time in the office and such. But.
So do you provide the booze, Franny?
No, but we have talked about some little gift cards, so that they can, got to be careful, maybe a gift card to Hy-Vee for groceries. So, And I do have to jump off for another call.
Yeah, I was just going to say,
sorry.
does anybody have anything else before we close? Do you find these sessions helpful? You want to do it again sometime?
Yeah.
Yeah, that's good. There's good information passed on. I like some of the
Yes. It's disappointing we didn't have more. We had quite a few folks. I invited every Nebraska individual that I possibly could. So maybe next one we'll get them on board. But thanks everybody. We really appreciate your time. And as always, if there's any feedback you have or something that we could do here at MAMES, just send us an email. Again.
Yeah, Joe, as you
Thank you,
continue
Rose.
those discussions with the state on the gloves, if you need anything, any help, any additional resources from either Rose or I'm sure I speak for Rose, I'll try to anyway. You reach out to either of us. We'd be happy to assist any way we can.
So I might actually put Craig, you and Rose in contact with Aaron this afternoon or this morning yet, and just doing a quick introduction so that you can discuss some of the stuff in California, Connecticut, and all that. So
Yeah,
that would be great. It's good to hear it from more than one person.
right.
Awesome. Great. Well, thank you, everybody. You have a fantastic rest of the week, and we will talk again soon.
Sounds good.
Thank you, guys.
Thanks.
Bye, guys.
Bye.
Bye.